We are going to be talking about acute liver failure in alcoholics. And acute liver failure presents itself in the bodies of people who drink pretty heavily over the span of years. And through this drinking, over the span of years, your liver goes through a process called fibrosis, which is basically tiny scars happening day after day, drink after drink. And after all these small hits, we eventually get a shrunken and hardened liver that reaches the point of cirrhosis, which is irreversible damage. It's mostly fatal, and it leads to multiple organ failure. And in this stage, the liver is unable to pass blood through as thoroughly as before, and it's also not cleansing the blood as thoroughly as before, which leads to a buildup of ammonia. And this also leads to a block-up of blood and fluid into the spleen, which makes the spleen swell, and that swelling destroys platelets. Platelets are super essential to blood clotting, which we will see later with the high blood pressure in the portal veins. But we're going to go on to jaundice, because jaundice is just a screaming, super in-your-face symptom of liver failure, because the person's skin turns yellow and their eyes are a yellowish, greenish, super weird color. And at this point, we know that the liver is failing to transport bile into the intestines, which is just a huge bile buildup in the body, which is a huge risk factor for infection. Skipping from jaundice since time, we're going to talk about the brain, because your brain majorly deteriorates in liver failure. Your brain basically starts deteriorating because a buildup of toxins, that ammonia that wasn't cleansed thoroughly in the blood, and those toxins are now poisoning the brain, which causes confusion and irritability, and you can even see it in memory loss. So it's a major cognitive decline seen in end-stage liver disease, where it makes them super sleepy, super groggy, and eventually they slip into a coma. If no other complications happen, they'll just go to sleep and never wake up, and all their organs will fail. And that's the most natural path of acute liver failure, but the reality is there's a lot of things that can happen in between. Because we have the high blood pressure in the portal vein, there's a chance of it rupturing, splitting, whatever you want to call it. And then because our platelets are being destroyed, that blood clot won't happen. They'll bleed out and die. There's also, a buildup in the esophagus, which messes with your breathing. And there's so many things that can happen that just complicate it in between, because if any specific organ fails, the rest is going to happen, and you can bleed out,